The last patient being treated for Ebola in Congo was discharged on Tuesday, the World Health Organization said, bringing the 19-month outbreak to an end. In that period, the virus killed 2,264 people and infected 1,200 more, making it the second worst Ebola outbreak in history.
Here's a summary of the article.
The last patient being treated for Ebola in Congo was discharged on Tuesday, the World Health Organization said, bringing the 19-month-old outbreak closer than ever to an end. The patient's release from hospital in the eastern city of Beni, feted by hospital staff who sang, danced and drummed on trash cans, marks the first time there have been no active cases since the outbreak was declared at the start of August 2018. Congo has now gone 14 days without any new confirmed cases. The outbreak can be declared over once 42 days have passed without a new case, equivalent to 2 cycles of 21 days, the maximum incubation period for the virus. A WHO spokesperson cautioned that the outbreak was not yet over, citing difficulties tracking cases in eastern Congo, where militia violence is widespread. Because of the complex security environment, Ebola transmission outside of groups currently under monitoring cannot be ruled out, said the spokesperson, Tarik Jasarevich. Even as caseloads declined last month and Ebola was overshadowed by the rapid spread of coronavirus around the world, the WHO said it continued to believe the outbreak constituted an international health emergency. The current outbreak, Congo's 10th since 1976, came immediately after another, smaller outbreak was ended in another part of the country in 2018.
This post received a score of 60,906, with an upvote ratio of 96%. Here are the top comments in response to this article.
Shout out to the health workers who help in fighting that Ebola outbreak.
Rip to some.
Crazy that coronavirus has already beaten the death toll here. 'Cause it's in China. Look at the population difference. Oh yeah, definitely, I just was surprised because I thought Ebola was a lot worse. I guess from reading the article, the first Ebola outbreak in 2013 to 2016 has higher numbers at the moment.
Ebola kills too quickly and ferociously.
Right. It has like a 3-day incubation period and burns through people so quick they can't really make it too far away.
Also, only one strain has shown to transmit via air and it was thankfully not killer BC. It was inadvertently released in America. Edit, for clarification, by not killer I meant that it didn't infect humans. Sorry for being vague.
Pretty sure that strain only infects certain types of monkeys. You're talking about the hot zone? It was mentioned in the book. The strain is Ebola reston. It did infect the workers but they showed no symptoms nor did they spread it, so thankfully the reston strain only spread and killed the monkeys.
Greater than the outbreak can be declared over once 42 days have passed without a new case, equivalent to 2 cycles of 21 days, the maximum incubation period for the virus. Interesting. Seems like a good metric.
Indeed.
Yes, quite. Indubitably.
Certainly. Positively.
Affirmative.
Inconceivably.
Obviously.
My balls itch. Yay, Congo pandemic bonds didn't defaulted. Now they can finally address COVID 2019.
Eli 5. Elementary understanding of bonds, but from my reading, they are betting against widespread human disease for profit.
It's more to pass risk off from people who don't want it to people who want to speculate on it. The classic case is a hurricane bond, which you might buy for $1 million so it pays a coupon, say $100,000, every year, but defaults, you don't get your $1 million back if there is a big hurricane while the bond is active. Insurance companies sell these bonds to hedge funds, pension plans, etc., and basically pass through insurance premiums in good years, but then if there is a major catastrophe they take the $1 million and use it to pay out insurance claims.
So gambling on nature instead of sports.
This is my understanding of the entirety of the stock market, legalized gambling.
I mean, insurance too.
Totally. But of course it's not like the insurance companies are rolling the dice. They know the odds, and they price insurance accordingly. But, yeah, there's an element of risk involved. I guess that's why stuff that is hard to predict, like acts of God, aren't always covered.
This video was automatically created by Reddit to speech. The article and comments in this video were selected from Reddit according to their upvotes, and any paraphrasing was performed by smmry.com, without any human intervention.